and welcome to this short recording on accessing specific learning differences screenings. My name's Tom and I'm a lead advisor on the Trainee Nursing Associate and the Nursing Degree Apprenticeship programme, and I'm here with Marie O'Donovan to talk about accessing SpLD screenings. Marie, would you like to just introduce yourself, please?
Hi, so my name is Marie O'Donovan. I'm one of the Children and Young People's Nursing lecturers, but I have an extra role where I am also the Disability Liaison Officer for the nursing and midwifery programmes, but also I kind of help out with the allied health professional programmes as well within HSC.
Brilliant, and thanks ever so much for joining me this. Well, we're afternoon,
worries.
aren't we? We have to check what time it is.
I know, yeah.
So what is the purpose of this recording and why are we doing it? So we want to kind of create a little framework to each of our discussions that focus around the what, why and the how. So what is SpLD and what it constitutes a screening? Why may you need to utilise that service? And once we establish that, how are you going to be able to reach out for that service? So Marie's very kindly agreed to go through that with us. So I'll just move us across and hand over to Marie.
Great, thank you, Tom. So what is SpLD? So that what it stands for, let's start there, is a specific learning difference. And so this is a screening tool that we use at UEA to screen for things like, you may have heard of the term neurodiversity, which includes things like autism spectrum disorder, attention deficit disorder or hyperactivity disorder, as well as dyslexia, dyscalculia, and some other variations. And this, just to be clear, this is a screening that we use for students that don't have a formal diagnosis. So if you have a formal diagnosis, so you've had an educational psychology assessment and you've got a diagnosis formally, then this screening isn't for you. This is for students who don't have that formal diagnosis, but you actually can get support via another route, and I'll kind of show you where that is, but you would access it through student services. But this screening is for students who who don't have a formal diagnosis of any kind of neurodiversity.
Okay, brilliant. So that's kind of what that screening is. Why may it apply to certain individuals that may be listening to this recording?
That's great. So why it would apply to you is kind of there's different schools of students who might fit into this why category. The first set of students, you may have been at college or some other form of education and you've been screened through that form of education, not a formal diagnosis, but you've been screened by them and they have said to you, oh, you have some form of a neurodiversity. You've screened kind of positive for dyslexia, say, or ADHD. And so we're going to give you the adjustments that would support a student with that diagnosis. So you haven't got a diagnosis, but you've completed a screening through another educator. So you know that you've got traits of a neurodiversity. Now, unfortunately, we don't recognise other education institutions screening. You would have to probably complete our screening here, which is what this process is, to then enable you to gain the adjustments and support with your academic and placement areas. So what the other kind of group of students might be students that have been told by, say, another academic who has had a look at their academic work or their communication style, or has noticed something, so it might be your advisor, and they have recommended that you do the screening to enable you to gain some extra support with your academic work. Because what we want is we want those students who may have a neurodiversity that haven't been diagnosed, that they're able to achieve the level that they can achieve. Because actually we know that if students have a neurodiversity and they don't get support, you know, they could be passing, but actually they could be achieving a much higher level with just a different level of support. And what, because it is a specific learning difference, it's just a different way of learning, which we might be able to put in place elements to support that learning. So you might get recommended by an advisor or another academic to do the screening. The other time you might get recommended, or you might think about doing the screening, is if you've ever wondered, you know, you've struggled with memory, recall, especially short-term memory, your speed of reading, or processing written information or auditory information. So when somebody tells you something, they tell you 3 or 4 points, you get those points modeled up. If you've ever struggled with communication styles with individuals or social situations, or organization, and your kind of just day-to-day management of life, then, and you've ever wondered, oh, I'm not quite same as everybody else, or I'm slightly different, I have different tactics, then you might want to consider doing the screening to see if, you know, you learn a bit more about yourself and things make a bit more sense, and then you can maybe gain some extra support with your academic work.
Yeah, fantastic. I think that's the takeaway message with this, isn't it? Is that you should never feel like you're being held back, and there's no stigma associated with having a specific learning difference. It just means that you are approaching the topics in a slightly different way, and with the correct level of support, you can achieve your full potential, which could be, you know, exceptionally high in some cases. So, you know, just pursue that. And again, if you're listening to this recording and you're thinking some of those little notes there that Marie's given, they sit with me, they sound quite personal to me, so I think I will ask for more information. I would like to go to look at the screening service now. How would they go about doing that, Marie, as we go into the, you know, the how do we get to these resources?
Well, I think that's a great question. And what I'm going to do is I'm going to share my screen, which is the main My UEA, because I think it's sometimes a good idea to show students how to navigate to these sites so you can do it yourself, rather than just sending out the link, because sometimes you lose the link and then you can't find it again. So hopefully, if I demonstrate how you navigate to these areas, that might be the most useful. So I will start sharing my screen. Tom, can you just confirm that you can see the My UEA page?
Yep, that's perfect.
Okay, so as a student, your My UEA might look different to mine because obviously I'm a staff member, but you should have similar boxes. You probably all got my email, you'll have Blackboard, and there'll be other elements. So there are multiple ways of getting to the page that I'm going to talk about, but it's all through student services. So if you know how to navigate to student services, you're already on the way to get into the screening. But for those of you who don't know how to get to student services, there are multiple ways. You can search student services. The problem with searching often, though, it brings up lots of options, and you might click on one and actually it's just a policy in student service. You know, it doesn't necessarily navigate you to where you want to go, but it is a way of getting there. The other way is to go through divisions and services, and then you come into a section where you've got boxes similar to My UEA, and you just have to find the one that says student services. Some people find that a bit tricky because it's a lot of information. It's quite busy. So again, it's up to you. If you want to find it that way, you can. My way of finding it is I stick with My UEA page and I go down to the wellbeing box. So you will have My Wellbeing, which is wellbeing services for students. Always a good caveat that this is a good way to get to wellbeing services within UEA. And I just use this as a way of navigating back to student services. So you see, we come through to this wellbeing page, and then I just click back to student services. And you can see it's part of the division and services tab, but it just, for me, that's the way I navigate there. So you just need to find a way that suits you. Once you're into student services, you'll see all the different tabs. But then you'll see this specific learning differences under learning and enhancement team, and that's where you need to come into. So you click on below, let the page load. And then here's all your kind of learning and enhancement team resources and other bits of information, tutorials and things, but you're going to aim for this specific learning differences tab. And again, you could search this in the menu and it would eventually get you there. But again, I think sometimes that can be harder than others. So once you're in this screen, you'll see the SpLD screening service. So this is where we're going to click into. But just while we're on this page, I'm going to make a note of this button here. So for those who, if you're still listening, for those who have a formal diagnosis of a neurodiversity, this is where you come to, accessing support if you already have a diagnosis. For some students who complete the screening, you will be able to then access, if you have a neurodiversity and it shows that you have a neurodiversity, depending on what that is, you will be able to access this specialist tuition, and this is the button. So once you know and have your report, this is where you go maybe for some more information, and you might want to go into the getting a diagnosis button and having a look at how the UEA can support you in the process of getting a formal diagnosis. The screening is not a formal diagnosis, so I just need to make that clear. It's not a kind of diagnosis in of itself. When you click into it, what you need to do is go, it's got some information and a little flow chart, but what you're going to need to do is get started, and you'll have to do a little application form. Okay. And the information you're going to need in that, it's an MS Teams form, is things like your name, hope you know your name, but things like your student number, your address, and some other information. So just your basic information that you would have, hopefully nothing too complex. And then it takes you through, if you have any issues during the process of the screening or the application, there's an email address, which is literally just the abbreviation spld@uea.ac.uk. And the screening in itself is a set of questions that you complete. So once you've done your application form, you'll get sent a consent form. Once you've completed that and sent that back, you then get access to a login to the computer system, and you have 3 months, I think, was last I heard. You have 3 months to complete the set of questions, and then you get a report very quickly, and that gets sent to the student services, and they'll put in the adjustments that they need based on your report. If you the actual question timing takes about 30 to 40 minutes, again, depending on your speed of writing, depending on if you need to take a break or not.
Okay, no, that's brilliant. And obviously these things sit quite nicely within the support with regards to assessment adjustments and reasonable adjustment plans and that sort of thing as well. But it's a start of that conversation, isn't it? And we've made another resource on accessing reasonable adjustment plans, etc. as well. So if you feel that that's going to be supported, just look where this recording has been cited, and it should sit alongside it. I'll just quickly share our contact details again, and go to share that on screen just at the end. But I think that that's been really helpful in terms of being able to just consolidate on where to find these resources and why it may be applicable to the people listening in. And just don't hold back. If you're ever unsure, just ask the question, whether it's ourselves, and I've put our email addresses up there, or if it's your advisor, if it's your course director or module organizer. The important thing is that you know how to reach out and that you do reach out. And I hope that this recording has been supportive in terms of just getting to know the subject a little bit more. Thank you for your time, Marie. It's been valuable as always. Look forward to working together again. And if you have any questions, just get in touch. Thank you very much. Bye, everyone.
Bye.